Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. I am Dr. Mudassir Shahbaz, Associate Professor in Sahara Medical College, Narawal, in Anatomy Department. And previously, I was discussing with you people about the anatomy of the lower limb, and the videos are available on the YouTube as well and at the Sahara site also. Now today we are going to discuss in previous lecture we have discussed about the anatomy of the ankle joint, the joint between the talus and the lower part of the tibia and fibula. And today we are going to discuss about the subtarsal and mid-tarsal joint. These joints are important to understand because the ankle joint is a hinge type of synovial joint in which the dorsiflexion as well as the plantarflexion that occurs, but the other movements, that the rotating movements such as inversion and eversion of the foot, that occurs mainly at the subtarsal joint. So before I start my discussion, I have found two slides made by some Doxa, and these were a beautiful slide made by that Doxa showing the joints. And this is the sequence what I say to you people, that in this manner you should focus, you should find your answers. That is, here is the proximal tibiofibular joint. Here, first of all, you want to know its articulation between the lateral condyle of the tibia and the head of the fibula. The articular surfaces look like they are flattened, covered by hyaline cartilage. Here we can see it. And then if you understand it, then the type is synovial plane gliding because they are flattened surfaces. So capsule, the strengthening things, capsule, then the ligaments, anterior posterior ligaments, strengthen the capsule, then the synovial membrane, then is the nerve supply and common movements. A small amount of gliding movement take place during the movement of the ankle joint. So it is because of the movement of the ankle joint that the gliding movement occurs. Otherwise, no specific muscle is moving this joint independently. And the next slide I want to show is this one. This is distal tibiofibular joint. It's the articulation, then it's the type. It's a fibrous joint. It's not the synovial joint, it's a fibrous joint. Means there is it's a syndesmosis type. It means that there will be a small amount of movement or no movement occurring at this joint. And the ligaments are the interosseous ligament, anterior posterior ligaments, and inferior transverse ligament. And here, because there is no movement occurring at this joint, so the no movement has been shown here. And here is shown the lower tibiofibular joint, showing the ligaments also tibiofibular ligament, anterior posterior tibiofibular ligament. Here only the posterior tibiofibular ligament is visible. Anterior will be on the anterior side. Now we have seen in the during our discussion is the talocrural joint, that is ankle joint. Inferior, then we are going to see that the subtarsal between the talus and the calcaneum, and mid-tarsal between the calcaneum and cuboid on the lateral side between talus and navicular bone on the medial side. Because when we see the bones, we see here the calcaneum making joint with the cuboid bone, and here is the navicular bone, and here again this calcaneum is making joint with the calcaneum navicular joint. Here is another joint, the talonavicular joint. We will discuss later on that what's the importance of this joint in the movement. So subtalar joints are just two joints between the talus and calcaneum, subtalar, and posterior talocalcaneal joint and anterior talo calcaneonavicular joint. The posterior talocalcaneal joint, designated as the subtalar joint. It's a mainly posterior talocalcaneal joint which is designated as the subtalar joint. So here we can see the joint between the, this is talus and this is calcaneum. So here is a joint, posterior talocalcaneum joint, which is mainly named as the subtalar joint. And here is the talocalcaneonavicular joint. Talocalcaneonavicular joint. Here is a ligament which is joining the calcaneum with the navicular bone, and this ligament is spring ligament. In the later slides, we will see that this joint is named as talocalcaneonavicular joint, and it is very important subtalar type of joint or mid-tarsal joint, which is important in the movement of inversion and eversion. Posterior joint between the talus and calcaneum articulation, you have seen in the previous slide the inferior surface of the body of talus and the facet on the middle of the upper surface of the calcaneum. A type, this is a synovial plane type of, it means gliding movement is going to occur on this, and some sort of rotatory movement also will occur. Medial and lateral talocalcaneal ligaments strengthen the capsule. The interosseous ligament is strong and main bond of union between the two bones. Interosseous ligament means joining the two bones, the flattened type of, and it is attached above to the sulcus steli and below to the sulcus calcaneum. That means that this interosseous ligament actually is filling the gap between the two bones, calcaneum and talar bone. So if we go to further slide, we see these ligaments. Stability will be provided by joint capsule and lined by synovial membrane, strengthened by the fibrous layer. A capsule supported by the three ligament: posterior talocalcaneal ligament, medial talocalcaneal ligament, and lateral talocalcaneal ligaments. As their name implies, anterior, posterior, and middle. Especially the the interosseous talocalcaneal ligament. This is very important. And here is the gap between, here the interosseous, here is the ligament, interosseous talocalcaneal ligament, and you are seeing that this, it is filling the gap between the calcaneum and sulcus and the tali. So it's a very special, especially strong ligament joining the two bones, interosseous talocalcaneal ligament. Other joints, the calcaneocuboidal joint, the calcaneonavicular, and the calcaneocuboidal joints are together referred as mid-tarsal or the transverse carpal joint, transverse tarsal joints. These two joints, calcaneonavicular and calcaneocuboidal, these are named as mid-tarsal joints. And the calcaneocuboidal is a synovial and plain variety, and ligaments they are attaching, they are named as bifurcated ligaments. Here is shown the movement that's occurring during inversion and inversion, and the axis of movement occurring at these joints. Here you can see the axis is not transverse or not longitudinal vertical. It is somewhat oblique, talonavicular and calcaneocuboidal. These axes you can see, and they are parallel here, parallel to each other. They will not cross at any point to each other. So this is in the normal resting foot. But when the movement occurs, that is inversion, especially or inversion especially. Here the two axes, they don't become parallel, but they will cross, they become angulated, and they, at some point they will cross each other. And in this position, it is said that the this joint, they actually lock the joint, the means the ankle joint, and the during movement on the uneven surface, on the stones or on uneven surface, when we walk, eh, by stabilizing or locking the ankle joint, the weight is transmitted to, and we can stand over it. So you can see in this diagram, you can see it's a, we are standing on with the straight foot, it's a normal one, and the two, these axes, they are not crossing each other. But here is right foot is inverted. Means supination is mainly used at the upper limb for the hand, but in the lower limb it's the inversion. That the we can see the supination but inversion here, and here you are seeing that these are crossing each other. And during the this during pronation, the axes of these two joints are parallel. This unlocks the joint and creates the hypermobility foot that can absorb the shock. And during the supination or inversion, axes are not parallel and this joint becomes locked, allowing efficient transmission of the force. So for the efficient transmission of the force, actually consider two joints, calcaneocuboidal and the lateral side talonavicular on the medial side. So the mid-tarsal joint. This joint is especially important, the talocalcaneonavicular joint. It's a joint, anterior joint between the talus and calcaneum and involves the navicular bone. And the articulation between the rounded head of talus and the upper surface of central tali and the posterior concave surface of the navicular bone, and lower is the calcaneum bone. And this is the synovial joint. And this, the one ligament which is very important is the frontal calcaneonavicular ligament joining these, making the part of the taliocalcaneonavicular joint, and also it's called a spring ligament providing the strength. Movements are the gliding and rotatory movements. Is strong and runs from the anterior margin of the subtentacular to the inferior surface of the tuberosity of the navicular bone. Here is the other ligaments, deltoid ligaments. The superior surface of the ligament is covered with the fibrocartilage supports the band of the talus. So its superior surface will be covered by the fibrocartilage, so giving the shape of the joint. So we have seen these joints in their types, in their movements occurring at these joints, and we have understood how the plantar flexion and dorsiflexion is occurring at the ankle joint, but the how the subtalar joint and the mid-tarsal joint, yeah, these are taking part in the movement of the inversion and eversion, and the ligament importance of the ligaments we have seen that. So when you will be asked about the rotatory movements, so the subtalar joint will come into consideration, and when we are so these are all my the nature has created these joints in such a way that when we walk on uneven surface, on the stone surface, and when we walk on this, so this provides the stability of the joint and transmission of the body force and body weight to the ground is maintained, and in this way we don't fall while walking on the animal surface. Now we are going to see some common injuries. Here are shown the very common, that is the ankle sprain. And here we can see here is the lateral fibulocalcaneal ligament, lateral ligament of the ankle joint. And here we see that here is injury, sprain. Type 1, this is type 1 when there is only ligament is stretched, but in type 2 there is the tearing of the ligament, but slight ligament, slight tearing. And in type 3, the ligament is completely teared. It's a very common injury seen. That is called in our language as Moj Ajana. So this is the first type which is called, and second type also sometimes. But here for the third type there is complete tear, so that needs then the surgical repair. Other types they are can be treated conservatively. So this is ankle sprain, which is in three types of ankle sprain. This is mainly the injury to the lateral ligaments and other ligaments that can also be stretched, such as the anterior talofibular ligament, which is one of the most commonly torn. Here you can see the mechanism, the basketball players, and in severe cases, the calcaneofibular ligament is torn and the lateral malleolus is fractured. That is in the very severe cases. Medial ligament that can also be injured, but is so strong when the foot is forcibly everted. The ligament is not torn, but it causes avulsion of the medial malleolus. Here we can see avulsion of medial malleolus. And along with that, there is fracture of the fibula. And the teres moves laterally, causing a break in the fibula because the teres moving in lateral direction. And it will cause the port fracture dislocation of the inferior tibiofibular joint. So injuries to the deltoid ligament, we have seen here the mechanism, but the ligament itself is so strong that when this ligament is injured, it actually there is avulsion of the medial malleolus, and because of movement of the talus laterally, the fibula is also fractured, and there is the port fracture dislocation of the inferior tibiofibular joint. Foot amputation needs sometimes in the diabetic patients, especially in the ischemic patients, when there is the ischemia or necrosis of the distal part of the foot. So in these cases, there is the you need the foot amputation. But in this case, here you can see, here is the plane that you are separating the talonavicular joint and also the calcaneocubital joint. And here is the plane through which the amputation is taken down. Avulsion fraction of the fifth metatarsal, fifth, here is the fifth metatarsal, and forceful inversion of the foot, avulsion of the tuberosity of the fifth metatarsal by the attached tendon of the peroneus brevis. It's the inversion, not the eversion. Inversion, that the peroneus brevis is trying to prevent the inversion, and but when its force is quite strong due to the attachment of this muscle peroneus brevis, there is avulsion fraction of the fifth metatarsal. March fracture, base of second metatarsal is firmly flexed. The anterior end of the medial and lateral cuneiform. Between the anterior end of the medial and lateral cuneiform. The second metatarsal toe form the axis of the foot. the mobility immobility of the second metatarsal and the slenderness of its shaft contribute to the spontaneous fracture between the middle repetitive trauma, stress fracture. So that's why repetitive due to the repetitive trauma to this bone and joint, there is spontaneous fracture of the second metatarsal bone. So that's why it's named as March fracture when you are walking for a long distance. Hallus valgus, lateral deviation of the greater to an abnormal extent, and prominent head of the first metatarsal that is named as Hallus valgus, very commonly seen in the females and also in some diabetics. Bursa develops over the projecting head of the first metatarsal, that is the Bionian. Biunia. Very important tarsal tunnel syndrome. Here is, you can see, here is a tunnel made by this uh, medial or flexor retinaculum extending from the tibia to the calcaneum, and under this tunnel passing the neurovascular bundle as well as the tendon of tibialis anterior, flexor digitorum, flexor hallucis longus. So, what is actually tarsal tunnel syndrome is result of compression or squeezing of the nerves in the ankle region below the tarsal tunnel. So, here is the position where the things are passing down into the sole of foot or plantar surface. So, these can be where the neurovascular bundle also passes below this tunnel into the foot. So, this can be compressed, and this, when it is compressed to some reason, it is named as tarsal tunnel syndrome. So when we see the tarsal tunnel syndrome, and some may anxious to know the treatment of this, the option may be very based on the length and time of severity of the foot condition at the time of diagnosis. So while treatment will vary from person to person, treated by cutting back on the activities that put strains on the foot and changing the shoe, that can also and treat the tarsal tunnel syndrome, or you need the shoe sports and inserts padding or tapping your foot to alleviate pressure and pain, and medications also given to control the pain. So here, in this way, I have mentioned this is because of that in upper limb we have seen the carpal tunnel syndrome, and it is very much like the carpal tunnel syndrome, because in carpal tunnel syndrome, median nerve is compressed while it is passing through the carpal tunnel, and here the nerves which are going to the plantar, that is the posterior tibial nerve, most commonly while passing to the foot, passes through this tarsal tunnel, and it can be compressed by some disease process. So that's named as that's I have mentioned the carpal tunnel syndrome here. So we have completed with the joint and further joints, that these are between the cuboid and navicular and the cuneiforms, and then the cuneiform between the base of the metatarsals and the cuboid and navicular bone, and then there is proximal metacarpophalangeal joint, then the distal metacarpophalangeal joint, which very much similar like the joints in the upper limb, and the movements are not so much, because in it's basically head of the metatarsal that supports the weight while walking on the ground, and that's why nature has made them in such a way that only flexion and extension are occurring, and some movement of the abduction. But the muscle layer will be the same as in the upper limb. So, inshallah, in the next lecture, we will discuss about the neurovascular in the sole of the foot, and we will see, inshallah. And fi amanillah.